Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Pane, this question comes in from our Facebook crowd, a question from the Miami area, and they are looking into plastic surgery after losing about 70 plus pounds with a vertical sleeve gastric procedure. Maybe you can talk about that for a minute. And congratulations for losing the weight. And they also have some supplemental questions on what may work best to improve their looks. And Dr. Pane, maybe you can expand on that and tell us what you think.
Yes, in this case, patient had what they call a vertical sleeve gastrectomy, which is a type of procedure, bariatric operation that we don't do, but we're familiar with how it works. And they're basically reducing the volume of the stomach. It's a powerful weight loss procedure, but it is an operation. The people that I know that do this typically send people home the next day, and they have very good success rates with it. You can lose a lot of your excess body weight with this procedure. And it doesn't require a lot of dietary modifications other than, of course, the volume, but it is not a bypassing procedure. So in terms of how your intestines on the inside work, it's essentially the same. It's not a gastric bypass. That being said, this person lost a lot of weight and has a lot of deflated skin. It's pretty impressive on the pictures. And here, rather than, this is not going to all be done at one stage. I would caution you if somebody says, oh, we're going to do all of this at one time. That is getting risky. In most cases, you want to start with some kind of procedure around the torso. And I would say it would be at least an extended abdominoplasty, which is what I say most of the time. Because a lot of times people come in and someone told them they need the front and back done, and they don't need the back done. In this case, they're going to need the back done. They're going to need to go all the way around, I think. And they may want to use some of that tissue to auto-augment the buttocks, because they were asking about whether they can do a fat transfer. I don't think this person has enough fat for a fat transfer. So it would be some sort of torso procedure first, maybe combined with the breasts. It would depend on health history and all of the rest of that, because a breast lift with implants is going to be something that they're probably going to want to consider here. Then at another stage, the thighs and arms could be done because they were concerned about the inner thighs and the arms. The arms actually didn't have as much loose skin as I would expect, but there is enough there where if the arms are a concern, that certainly could be done. But I would say in most cases, this is going to be a minimum of 2 stages, maybe a third, depending on what's happening. But if the health is good overall and everything else is taken care of, then it should be very reasonable. We do this again as an outpatient in most cases, depending on how much is done. And I think that they will see a very good improvement to get them as close as possible back to the pre-weight gain body, which is important to keep in mind. You really can't get 100% back, but you get as close as you can. So hope that helps, and that should help get them on the path to where they need to go.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please reach out to us on our Facebook page, LinkedIn, Instagram, or Twitter account. And Dr. Pane, we appreciate your time, and we'll see you on the next one.
Great.